Yes, my name is Jitin. Just to give you a brief introduction, I'm a technologist. I do work on technologies. I work on almost all latest technologies. That's how I do. I work on mostly cloud-based technologies, and then I also started working on AI, Gen AI, and then artificial intelligence, machine learning, these kind of era. I started investing for the past few years, and then now I'm getting into the mainstream stuff of this AI. Mainstream stuff means I started working on the projects in AI with the knowledge that I have acquired. Right. So welcome all. Pretty good afternoon. This talk is about AI trends for the nursing, but it's not only the I not only talk about the presentations that I got to present, but I also talks about what I have seen, what I have observed so far over the years about nursing. Of course, I'm not I may not be a qualified person to talk about nurse, but I'm a qualified person to talk about the technology. But as a patient, as a supporter to a patient, I always could observe certain things. That's how we learn. By the way, my birth was uh, itself was not artificial intelligent because my birth was a vaginal delivery, and then I still remember the nurse name because my mother was kept on telling her name. Kanakamala was the nurse name. I probably I could have seen her face first. So that's how my life started. So I always have a lot of respect for nurses, and I think I might have seen her face when I was born. So a lot of gratitude, a lot of respect. It started from my birth itself, so you can understand my gratitude or my respect towards nurses. Fine. So what I'm trying to bring over here, my birth was not artificial intelligent. I'm not saying that the deliveries that they do through surgeries and all, I consider them as artificial intelligence because majority of the deliveries could have been even the natural vaginal deliveries. But yes, we bring something in between and then we make it as a artificial birth. The way how we come out is what actually naturally are we coming out and then or artificially we are coming out. It's fine. So let me talk about the this talk is for the AI for nursing. uh, yeah, how the AI is going to be integrated or even it's being integrated in nursing and is what we are going to talk. It's going to bring the it's going to revolutionize the healthcare delivery. What we're gonna get it enhancing the, of course, the patient care, streamlining the workflows, and addressing workforce challenges. That's where we are going to, and many more things are going to come in the future. We cannot really predict the future because it may drastically changes happen in the future. I'm not talking about I'm talking about the future after I think 20-30 years. But at least right now, from now onwards, we could see that what are the changes that are going to happen, what kind of benefits that the nurses are going to get and the patients are going to get due to AI. So my first question was, you can unmute and tell me, when have you first seen uh, and understood that this is AI? What was your first experience that, hey, this is an artificial intelligence? This particular thing, this particular object is an artificially driven object. What was or what is your first experience? Yeah, you can unmute and then give me uh, something about it. Anyone? Okay. What is artificial intelligence? Because the intelligence that we gonna inject to do any task, it's my definition. I'm not copying definition from anywhere. The intelligence that is used to to perform any task or to drive any task, generally it comes from our brain. But it is artificially driven. That means it's not our brain or our muscles always do the work, or the objects that are driven by us or always doesn't do the work. That which we call it as an artificial intelligence. The object we call it as which is artificially intelligent. My first notice when I first noticed that when was the artificial intelligence, my first notice was I used to go to a office nearby my home along with my aunt. My aunt was she adopted me. Then I used to be there with her always. Then I used to go to a lot of offices, government offices. So most of the government offices, when you go to the officer, whether it is an MRO or a Tahsildar, a sub-collector or MDO, BDO, any office, or a health department officer, wherever you go to any office. Since she was a principal, I used to go to a lot of educational related offices. There used to be a Dutch door. Dutch doors are half doors, partially closed doors. Only the upper part of the door is closed, and then the lower part is let is kept it like that so that the air flow and the lighting comes. Then whenever you open the door and then you get inside, automatically the doors gets closed. They use some artificial intelligence technique for the door that it gets closed automatically. They use a spring or they use a usually they use a spring. They use a spring for that. That was my first notice that hey, how this door is getting closed. And then I understood. There is no hydraulic as such that, but there was a spring. Whenever you open the door, you get in, and then once you get in and leave the door gets closed automatically. Nobody was standing there, or neither you open the door and close the door. When just you move in and leave the door gets closed automatically. That was my first as far as I remember, that was my first. As I said, my birth itself was a not by artificial intelligence. It was vaginal delivery, but I don't know that time. But whenever I noticed, that was my first instance when I really observed that maybe I was 6, 7 years age. I observed that hey, this door is getting closed. Then I paused for a while and then observed it how the door is getting closed. Then there was a spring, not a hydraulic one, but normal spring. Then I understood, oh, this is getting closed. Then I used to come and then gather a lot of springs from my pens and then try to do a lot of things with that spring. Try to do a lot of artificial intelligent things. But however, that was my first instance. So what I mean to say is artificial intelligence is not always about computer technology. It's not necessarily to be a lot of code that is running behind the scene and then a lot of things are happening with the computer technology. Artificial intelligence is something that artificially driven with a minimal or no manual intervention. We call it as an artificial intelligence. It's not necessarily to be a lot of technology that is involved, but now it became very de facto standard, became a imperative stuff in nowadays because a lot of technology is helping us to really do things artificially. A simple example, another example I give you, you go to ChatGPT, for example, you want to prepare, I think you some of you are going to prepare the duty list in your hospital. Maybe some of you are already took leave and working as learning your academics, or some of you are very fresh. But once you are into your duties, generally you get to plan your duty list. You go to ChatGPT or DeepSeek or Grok or any artificial intelligent generative AI technology, and then just type that there are 4 nurses or 4 doctors, whoever are going to plan for the duty. We are 4 people or 6 people or 8 people, whatever it is. Okay, these are our duty timings. Can you please prepare a roster for me? Immediately within few seconds you get a roster. Earlier you used to use olden days, not even olden days, not even now. We use actually what do you use? We use uh, applications to perform a roster, or you use a Excel sheets or spreadsheets to prepare rosters. But unbiased roster can be done by your artificial and chat GPT or all these GPT tools. They can prepare a roster and give you. It's unbiased. Definitely it is unbiased because that doesn't know that who is whom, okay, who it has to favor, and all these things would be completely isolated. It prepares some duty list. Maybe you can ask that, okay, among them, four of them are lady nurses, so please don't give so much of night duty to the nurses. Then it will also prepare the duty list to minimize the night shift for the female nurses, right? So let's get into the topic actually. What are the features? What is the future? What kind of things that you could foresee in nursing? So clinical decision support systems would come into the picture. Okay. Have you ever gone to any uh, anesthesiologist to ask to go for any surgery? Generally, they ask for your ethnic. They ask for your what region you belong to, what caste you belong to, because based on that there are some changes in DNA. Based on that, they used to give some injection. What are the injection they are? What are the how you metabolize that particular drug they give? How it metabolizes in your body, particularly that drug may act upon you. The reason is there are some DNA changes in different regions in India or even in the world. Particularly, the South Asia has that particular problem. How their bodies react to that particular medicine. They used to ask what caste you belong to. Really, I don't want to talk about the caste, but I'm talking about the context. Uh, Anesthesiologists generally ask you, okay, what caste you are. You may be surprised why he's asking me about my caste. Okay, is he going to do anything with my caste? But it's not like that. They would like to know your caste before going to give the drug. I have seen a couple of examples. I observed a couple of examples of about that because the DNAs are different. The genetic changes or genetic differences among different people from different castes have different genetics, of course. So how the medicine is going to metabolize in your body, it is different for different people, different caste, different region, maybe different religion or whatever. You can see that actually, the clinical decision is very, very important actually. So they need some inputs from somewhere. So ultimately, where do they get the inputs from? They get the inputs from the patient itself. What caste you belong to, they ask. Here it happens in my state, Andhra Pradesh a lot, because they ask what caste you belong to. Because certain castes have, uh, they take their DNAs are little different. So the way how they take the medicine, particularly the anesthesia related medicine, the drug that they're gonna give is it acts differently. So they ask their caste. You might have noticed or not, but I have noticed. So the clinical decisions or the decisions that pre-surgery or post-surgery, it depends on person to person, right? So there would be a trend that AI will support nurses particularly because nurses are the nurses do major part before the surgery, pre-surgery or post-surgery or during the phase of the surgery. Nurses play a critical role. Their role in these areas, well, of course, the entire medical workflow, if you see it, nurses play a vital role. Okay. I still explain you one more example. I come from a family where there are so many doctors. Okay, my wife herself is a doctor. So whenever I ask her, can you please, she says that you have some issue, so you need to go for some injection. I used to ask her, can you do the injection? She says, no, 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 I can't do the injection. Says she's a radiologist. She says that no, 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 I can't do the injection. Nurses are the best people to do the injection because the precision identifying that precisions of the nerve, identifying the nerve is a trick that actually it's a precision point kind of a decision that I cannot take. I'm so scared. So please go to the nurse and get it done. Generally, what we feel, okay, doctors can do anything, but it's not. It is my experience. So they can't do anything, whatever you really think of. I'm not saying they can't do anything, but many of them they rely more on nurses than themselves itself. I'm not talking about any other doctor. I'm talking about my own experience. They rely on nurses because they know that nurses can do things pretty meticulously. Certain things even the very famous doctors are not able to do. Maybe it is their job. Still, I don't think doctors don't know how to do an injection. Still, they prefer a nurse do an injection rather than a doctor herself do the injection. That's the importance that is given by the doctors to the nurses. So, yeah, fine. So evidence-based clinical decisions is very, very important. It's by analyzing the patient data. Generally, we have got the data of the patient, of course, medical histories of the patients and real-time monitoring of the patients. Everything will be AI driven. Right now, you may be manually going and checking the history and then what are the clinical decisions that were taken earlier or that has to be taken right now with the data and the history you have got. I mean, you means I'm talking about the nurse you have got or the real-time monitoring. The trend would come, or even the trend is going on right now. AI would support you. I'm not saying AI would take a decision. Still, the human has to take the decision as of now. As of now, the future we can't say. Okay, AI would take the decision. Sorry, AI would support the nurse to take a decision based on the data it has got, how difficult it is to identify, read each and every document, how easy it is to let AI read the document, understand the document, and then give you some pointers. Say this summarize you that hey, this patient is this. It looks like he has got some allergy to these kind of medicines. Be careful. Okay, this is the history. I could see the history of the patient. I have learned about the history of the patient after going through all the records. So these are the decisions you have to take. What kind of a benefit it's going to bring? It brings, of course, diagnostic errors and it improves accuracy. So how many times, before going to give a drug that you give a sample drug and wait for 15 minutes or 20 minutes, mark it on with a pen or a marker that, hey, let me know if you get any itching, let me know if you get any kind of a swelling on the body, anything, any reaction you could see. And after half an hour or 15 minutes or half an hour, you come back and do. In fact, you don't need to do that. Once AI gonna support you, of course, proper data provided by proper data to the your AI engines. AI can understand and tell you that hey, this patient or this person has got some allergy to these medicines, so be careful when you are going to give the medicine. Right now, it may give vague data because the gathering information of a patient is not streamlined. But going further, from now onwards, definitely the AI will assist you in each and every step of this, bringing the accuracy for the clinical decisions that you take. Okay, so it also because you are doing the real-time monitoring. So generally, real-time monitoring is what actually it gives you some alert. How many movies that at least not standing at the patient always, how many movies I could have seen or others I could have seen. There is a beep sound that gives along with the monitors that are plugged to the attached to the patient. Based on the beep sound, we can understand that something is going to happen. Okay, the big beep sound or the beep sound is stopped or the you know the beep sound is not in a proper interval, then it is an alarm that person who is sitting next to the patient who is supporting the patient then ran to the nurse and hey nurse the beep sound it looks like something is happening to the patient. It's an alert basically. What if the alert is automated? What if the alert is come to a automatically instead of the support a person who is standing with the sitting with the patient, automatically the nurse gets a notification in his or her mobile or on a device that she or he can use, or how it can predict that something is going to happen in another 10 minutes or 15 minutes and then give you some notification that after reading this data, I could understand that this patient may have something wrong is going to happen to the patient. It looks like after reading the data. How good it is. These kind of things, the clinical decisions that you're gonna take or decisions that you cannot take, would come into the picture. The other thing is the next one is predictive analysis. That's what exactly I was talking about. Predictive analysis, analyzing with the past data, analyzing the future things, analyzing some incident has been already happened, analyzing about the event, analyzing the patient data with the past record, analyzing the patient data and then provide you the predictive analysis is very, very important. That's how the predictive analysis is core for any artificial intelligence. Okay. That what predictive analysis will do. All these things are done by AI. So I'm not going to mention AI everywhere. All these things, whatever we are talking today, is about AI. So the predictive analysis, uh, it's going to give some analytics. Okay, whether a patient is at risk or not, based on the data history that it has acquired, based on the real-time data it is going through, whether are there any complications is going to happen, any chronic conditions that may are going to happen to the patient. It give you some alerts again. It presume that yeah, this something is going to happen to the patient. 100% it may not tell, maybe in the future it may tell, but it would give you some kind of an analysis that it looks like this patient is going to happen, going to have something within half an hour, within 1 hour. Now the watches came. Even when you fall down, okay, when you fall down, the watch would get send a signal to the emergency department, most probably in USA and all. Apple watches and some watches and some devices specially designed for medical purposes. Okay, even it can detect that the patient is going to get a heart attack. Okay, even it can detect that it's all predictive analysis. Even it can detect that the person is going to fall down, going to get into some kind of maybe coma. Okay, so these kind of analysis, predictive analysis, is automatically always okay by extracting the existing data. This kind of analysis can be done by the tools, particularly the AI. This would really give a lot of insights into what is happening with the patient. When something goes wrong with the patient, it is not the doctor that's going to be attended, right? It's the nurse who is going to attend the patient. First person is the nurse. As I said, I could have seen the my nurse Kanakamala first time. Similarly, I don't know that it was told by my mother, but it's the nurse whom you're gonna see at first. The patient the nurse is going to attend the patient at first, not the doctor. So nurses should have lot of information. Tools should help the nurse more than anybody else. So this is called the predictive analysis. So what predictive analysis is gonna give you? The impact is it's proactive care. So you know that the patient is going to get a heart attack. A proactive care that you can even call a patient and tell that, hey, it looks like your data. I could observe your data. It looks like there could be some. I'm sensing that the system is sensing that you may get a heart attack. So don't take a lot of strain. Sit somewhere and then please calm down and then reach the clinic. How good it is. Just giving you an example. How good it is, right? So it would reduce. Of course, it would reduce the hospital stays and costs, but it would also enable the patient that that be alert and be ready for the unforeseen circumstances, because it's a predictive analysis. There are two things. The predictive analysis, of course, it would bring down the cost for the patient, because he's already informed that there may be something goes wrong. So there is nothing he can do in a hurry. Rather, he can take his time and visit the hospital. But meanwhile, he should not be doing the things that he's not supposed to do. Okay, maybe he's a diabetic patient, or he's a patient which has got some heart condition. His heart is not functioning properly, maybe a blood pressure or a thyroid, whatever. I could say only based on the knowledge I have got. But AI can do the predictive analysis. That's what actually the essence of this. A lot of machine learning models are there to analyze the data. Based on the data, it can do the predictions. Those predictions would be enabled to the nurses, particularly because they are the first contacts They are the first contact person to the patient rather than anybody else. I mean, with respect to the treatment and medical related things. So it's not only taking care of the patient, it's a lot of administrative tasks that you have to do. Okay, how much time you're consuming, how much time you have to be there in the hospital. As I said earlier, how do you prepare the roster for the, I mean, maybe one of you have to prepare the roster. You cannot appoint somebody to prepare a roster for you, right? Your schedule should be maintained or by yourself, maybe a lead or a head of nurse or someone has to do the roster as far as my knowledge is concerned. What you have got a lot of inventory with you, inventory in the sense you may be having a pile of salines, the pile of injections, syringes, and then you know surgery materials. These are all maintained by you. All these things are within your, you handle all these things. So definitely you have to do a lot of to management and administrative tasks. Maybe end of the day you may have to write down how many things were consumed, how many things are left. Okay, by end of the day, you may have to maintain the timesheet, or you may have to maintain the records when the injection was given to a patient, then when the next person who would be in the duty has to give the injection or give the medicines, what are medicines were given and all. All these things would be automated. Okay, provided by some input. Automation do not happen without any input. Of course, you have to give the input, but that's an automated. Instead of you write down on a register, what if you just click a button so that automatically all the informations are informed to the person who is going to take over charge from you. So these kind of automation of administrative tasks are not just doing or caring the patient, but after along with the patient, you may have to do a lot of things. Okay, all these things will be taken care with the fewer inputs by you by an AI tools, and then things get automated. How easy it is! It would reduce a lot of your time. So it reduces the burnout and improves your job satisfaction because yeah, I'm a nurse. How many times you felt that more than my nurse duties, this administrative task has become a cumbersome for me. It has become a headache for me. How many times you happily do your job, but you feel the pain when you have to do write a lot of details on the paper on the registers. I know that, right? It's we don't like to do the clerical job. I mean, none of us, whether I'm a technologist or you are a nurse or somebody is a doctor or somebody, we don't like to do the clerical job. You like to do the your core job. What if the AI is going to help you out to perform all these things? How easy instead of you write down everything on a paper on the register, you just understand, you just speak out to a voice to text assistant that would write down everything for you. Natural language processing models have come into the picture already. Voice to text is already evolved, but there is a tricky part. The current tricky part is the voice to text is you need to pronounce in a better way. Right now, it expect you at least to pronounce in particular language. But the days are not too far that it can recognize your voice, it can recognize your accent. People from the south have got a different accent than people from the north. Even in the north, people from Bihar may use a separate accent. People from Kerala use a separate accent. People from Andhra Pradesh have a different accent. How easy it can understand your voice. Okay, not based on from where you are from, just based on your voice, and then it can prepare a text for you. It's pretty easy, right? So automation of administrative task is not just the NLP, natural language processing, but it is much more than what actually we have discussed already. It's much more than that. So the virtual nursing assistants, I think that it is the future. Virtual nursing assistant may bring down the work of nurses because the virtual assistants will be a maybe a AI nurse. It support patients. Okay, so there is a tricky part here. It tries to bring down the number of nurses. Actually, it is a negative part as well because much part of your work is done by AI. Even the technologists, we are facing the same issue. Much part of your work is done by AI then why should we keep so many technologists? That's how the thing companies are thinking. But your jobs are more safer than a technologist job, because even all these tools will help you actually to provide, uh, improve service, improvised services, to provide actually rich services, richness in your service, But actually, these things, there is a little negative effect on this. It will bring down the number of jobs as well in the future. So AI driven virtual assistant will of course provide 24 by 7 support, because these are all the artificial intelligent machines that make you directly give information to the patients rather than even a human intervention. Human no need to intervene in many things. The AI assists the patient directly, so they may answer queries to the patients. Of course, the nurse may not be always available with the patient, so that whatever the questions that are asked by patients, the nurse can answer. Of course, whenever the nurse comes to the patient, he or she may ask a lot of questions, and nurse with a lot of patience, he may answer to the patient. But you know, if what if there is an assistant which can give me all of how ChatGPT you are using, any question you have got, you just go and then simply ask ChatGPT, hey, I want to know this, I want to know that. Can you prepare a documentation for me? Can you prepare a roster for me? All ChatGPT or any GPT engines can prepare for that. What if instead of a real nurse, an AI assistant can cater all these things? That is where actually virtual nursing assistants come into the picture. Still, I don't think the virtual assistant without a nurse intervene into the system can do everything. But yes, but the input should be given by nurses. So nurses should understand that okay, the future is with AI. Sorry, the future is with AI. So, okay, let me learn myself by embracing UI. Let me train myself to work along with AI. So you may have to give a lot of inputs to the AI as well. AI cannot work without proper inputs. AI may mislead people. So at the time, a nurse can intervene into the system and say that, hey, AI, you're doing something wrong. This is the correct way of doing things. But definitely the future is with virtual assistants, virtual AI-driven assistants. These assistants will do major part of at least question answer kind of a things to the patients. Okay, already chatbots are available. If you book a ticket in any airlines, the chatbot is available. It answers you. A lot of chatbots are coming along with your WhatsApp as well nowadays. Even if you get into any WhatsApp group and all, I know chatbots are coming. Many companies, organizations are coming with chatbots. How many hospitals they have their own chatbot can answer many of your questions. I would like to book an appointment. Chatbot could help you to book an appointment, right? But these questions, what are the questions that the AI virtual assistants, one of the very crucial part, when someone has gone for a surgery is being done, the surgery is done, but post-discharge precautions are very, very important, right? It's is equally or maybe more than important what kind of care that has to be taken post-discharge. A nurse come to the patient and tells that, hey, you have to take care, don't make that your body get wet. Okay, please change the dress your dressing, do the dressing every alternate day, or use these medicines properly and all. Then what happened after the patient or the assistant who is assisting the patient, he reaches home. One day they do that. The other day they call the hospital. Can you connect me to the nurse? Maybe he may tell the name. Okay, can you connect me to maybe someone called Subi? Can you connect me to the Subi? Then Subi is surprised. Maybe Subi doesn't have any knowledge. Who is the nurse? Or who is calling? She says, yes, I'm Subi speaking. So, hey, I was in your hospital for 4 days. Okay, can you tell me what kind of precautions post discharge I have to take? Then Subi tells that we have already discussed with you exactly, because we deal with a lot of patients. I don't really recollect with whom I am speaking. Okay, can you send your report? We will come and then we will cross check and come back to you. These kind of information generally, these kind of queries you get. I think I have done that. So I'm talking from my experience. So what if instead of Subi or Tushar, someone else, not Subi or not Tushar, but you ask a question based on your records, based on your patient, based on the records, the AI assistant would answer all the questions that are asked by the patient or the assistant who is supporting the patient. How good and how easy your job is. This is where exactly the virtual nursing assistants would come into the picture. IoT devices generally enhanced patient monitoring with IoT and AI. Uh, IoT devices means Internet of Things. IoT devices means the devices, the small devices, generally they are small devices. Uh, they may be attached to the patient body. IoT devices are not only because of the patients and all, IoT devices are everywhere. A router inside your home could be an IoT device. A dashboard on your car which keeps on sending information or GPS information is also a IoT device. We call it as Internet of Things. Okay, data is transmitted, data is sent from those devices, giving the information about a car to a server. Generally, we call it as an IoT device, which we call it as a Internet of Things. Okay, a watch is worn by a patient. From the watch, actually, every now and then you get an information. Okay, a simple example I tell you, every patient that gets discharged from the hospital or the patient is in the hospital, you attach a device to the patient. You tie a device to the patient hand or maybe a neck or maybe a leg. I don't know. It's going to be even the chips are implanted in the brain. So exactly I may not say where the device is. Let's be a ring or a watch. Let's be simple. You want to know that that how the patient is doing. Okay, how are the electrolytes of the patient? What are the vital signals of the patients are? How the heartbeat is, how the BP is, how the sugar levels of the patients are. You regularly get the information, but it doesn't mean that you have to sit and watch the information. But IoT devices is kept on sending information. A watch is tied to the patient after his discharge. Then for a week, you would like to tell the patient, hey, this watch you have to wear it for a week. We would like to monitor. I'm just giving an example how the future is going to be, or maybe permanently. Let's assume that a week post discharge. Then you get all the information from the patient watch. All the information is gathered from the patient body. Those are gathered by the watch and then they are sent to the hospital servers. Then the AI engines will analyze the data and then give some alerts, some information to nurses. Okay. Why I'm saying nurses? Why not doctors? Of course, nurses are the uh, 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 nurses are the people who are available always to the patients. Nurses are the first contact to the patients, not the doctors, right? And then nurse doesn't need to sit in front of the monitor and always watch what is going on with the patient, but nurse get alerts whenever things go wrong, whenever some body vitals, I don't know whether it's a correct word or not, maybe electrolytes or here and there, not inappropriate electrolytes are there, or extracted or taken from the patient. It looks something is going wrong, then you get an alert and immediately you alert the patient, or you go to the patient. Okay, from the hospital, some of the nurses who goes, she or he goes to the patient and then treat them how good it is. So IoT devices are going to be, I think still IoT devices are already available in the market. Maybe continuous monitoring of diabetes and all is being continuously monitored. Uh, there are a lot of devices are coming up. Non-invasive glucose monitors are coming up. Uh, Going forward, even the chips are implanted into the patient's body, and then all the important information is gathered from the patient and then sent to that servers. That is called IoT device, Internet of Things. There's data is captured and data is forwarded to the server. So how good it is. So here, real-time tracking of the vital signals, vital signs. such as heart rate, blood pressure, oxygen levels. These are the basic things. The going forward, even many things would be captured. Okay, not only the blood pressure, blood sugar would be monitored, maybe thyroid would be monitored, maybe all the electrolytes in the body are monitored, how the potassium levels are, how the calcium levels are, how the whatever the levels are, how the blood pressure is, how the salt levels are in the body. All these things are monitored, captured, and sent. So the real time data is being monitored and the alert is given. So not only the variable devices, but also the implanted devices would come into the market very soon. So be ready to accept these changes. Personalized patient care. I think personalized care is going to be revolutionized. The reason is so far whatever the medicine that you are giving is generalized medicine. In fact, recently I got to know that there are a lot of short of doctors in Australia. Instead of doctors prescribe, okay, nurses are also given authority to prescribe few medicines to the patients. Uh, uh, exactly 100% information I don't know, whatever I have heard. Okay, nurses are legal, legitimate to give some medicines, of course, or not, because they have not identified anybody else other than nurses, because they know they always deal with the drugs. They are It is legal for a nurse to give some information. It's legal for a nurse to give some medicines, to prescribe some medicines because of short of doctors, I think. Okay, personalized patient care means so far the medicine is given based on generally we give, if you have a medicine, if for example uh, I have fever, the default medicine is paracetamol. Okay, I have maybe the running nose. To stop the running nose, maybe I go for cetirizine. There is a medicine generally, it is prescribed generally. But what if it is a personalized medicine? Personalized medicine, personalized patient care, personalized medicine, understanding the history of the patient. As I said, that anesthesia example. Okay, what if the personalized medicine is going to be a next big thing, whatever I have understood. The medicine or the treatment would be given based on the personalized data, not based on the general data. Okay, so not everyone right now, everyone is given the same medicine. If you have a fever, get the take paracetamol. If you have headache, take something. If you have diabetes, then take metformin or maybe some mixed drugs with along with metformin. Okay, if you have something combiflam, something like that. But what if the personalized medicine? So these personalized medicine would be the next big thing in the medical sector. So so there are, billions of people, 800 billion people are there as far as I know. So you cannot, as a human being, it is highly impossible to go to each and every person, understand, track their record, understand all their history, and then give personalized medicine. But AI can do that. AI will enable hyper personalized care plans based on the genetic, lifestyle, ethnic, as well as regional, and all, takes all the things based on their previous data, uh, based on where actually maybe they are staying in uh, southern areas or northern areas where they are staying, and all, everything, all the data is taken, and then and also the environment factors, they give a personalized prescription, they give a personalized clinical advices. How good it is. This is what going to happen with the help of AI, because as a human being, manually you cannot track all the records, we cannot do all these things, but AI can do that. So tailored interventions improve patient outcomes, of course, enhanced patient engagement and satisfaction, of course. Uh, you are going to give the medicines that are tailored made only for that particular patient rather than a group of patients who are suffering with the same disease. Okay. uh, we are successful so far, as a patients or as a medical practitioners, as a nurses, we are successful so far. But you know that every medicine that you're gonna use has got a negative impact. Of course, that's how it got documented that okay, if you take this medicine, you may get diarrhea. If you get this medicine, you may feel some pains in your body. All the things are maintained. You know, if you go and search what are the negative effects if I take metformin or if I take some other drug, you get all the list of the medicines. Right. That is good thing about the English medicine. I don't degrade any other homeopathic medicine or the other things, but other things are not as good documented as English medicine. I always say that English medicine is better than those things, not because I don't have any other things about traditional medicine, but English medicines are documented properly. So since they are documented properly, for the AI tools, it's pretty easy to go and grab the things because some data is required. How they are documented? They are documented because of their clinical findings. They are documented because of their research. Okay, they understand that if you take maybe a metformin, you may get diarrhea. Some people may feel diarrhea. Some people may feel some dizziness. You get everything is documented. Everything gets documented. You can go and see them. But these kind of things you can't see in any other medicine. That is one of the best things about the English medicine. Okay, I'm not degrading other medicines. Yeah, they have their own things, but the documentation is one of the imperative part that I see, particularly from the technology perspective. Technology can work when it has got the history. Technology can work when it has got a lot of documentation, lot of information available. So it is pretty easy for AI to work with English medicine than to work with the homeopathy or the Ayurvedic medicine. They may be doing some similar kind of research. I'm not aware of that, but it is pretty easy for AI to work with English medicine because everything got documented. So this is what actually personalized patient care. Robotics in nursing, of course, a lot of robotics came in many areas. I have got a robot which can go and clean my house. The small circular shape something, it goes and cleans my room. It can detect actually where the dust is. It can go there and then grab, sucks all the dust. Robotics are everywhere. So the robotic is very crucial for the bedridden patients. Okay. Because so far, actually, the bedridden patients are taken care by humans. There is very less technical intervention over here, you know. But what if the AI robots come into the picture and assist the patient? Physical tasks. So far, we are talking about the technological tasks. But what if the physical tasks also can be done? Lifting a patient, as I said here, delivering supplies, supplements, supplies, or performing repetitive procedures. Every day it has to come and then ask the patient, "Okay, have you taken medicine?" Instead of a nurse come and then ask, "Hey, have you taken medicine?" or give the medicine to the patients. Even I could see nurses are so kind that not only asking the patient to take the medicine, they even remove the medicine from the sheet and give them with the water. That is a fantastic job. It's a kindness. It's an empathy. That nursing is not something. It's a job. It's more than a job. They comes with the kindness, right? I have seen many nurses say, "Hi sir, good morning. Have you taken medicine?" I say, "Yes, no, I've not taken medicine." She or he comes there, remove the medicine from the sheet, and then put the medicine in my hand and asking, "Can you please take the medicine and drink water?" Even giving me the water. So the kindness, of course, robots cannot be kind. That part of the emotional thing cannot be brought from the AI assistants, as far as my knowledge is concerned, as far as I could see. But still, the repetitive jobs, of course, the robot would go and then give the medicine, can advise to take the medicine, ask the patient to give the medicine, to lift the medicine if he or she wants to go to the toilet, or clean the patient, but the emotional intelligence, the emotional thing cannot be done by not the emotional intelligence, but the emotions cannot be done by a robot. But the emotional part can be done by a nurse. Hello, sir. Good morning. Have you taken? How are you doing today? Have you taken medicine? All is good. Like that, you can ask. But still, the work is done by the robot. So these robots would not going to change, remove your jobs, but it would be your buddy. Maybe a robot would be roaming along with each and every nurse. Okay. So robots will do a lot of the jobs, particularly the laborious jobs, particularly the repetitive jobs or the physical tasks can be done by robots. So reduces physical strain on nurses, of course. Nurses do a lot of things, improves efficiency and resource limited settings. You know, scarcity of the resources are inevitable. Just today I read that Elon Musk has got his 15th kid. I think 14th kid. I'm sorry, 14th kid. I am saying 14th or 15th kid. So once I read about him that, uh, you know, what do you think about the when the humans will extinction? He said that I could foresee that human extinction is not by any asteroid or not by any calamity. The human extinction will happen because the number of humans will come down. Ultimately, there would not be any humans on this earth due to various reasons. But this, so what I'm going to help this particular for the humans. So I'm going to give birth to as many babies as I can. So well, it's true. In fact, elsewhere also I read that humans will extinct not because of an asteroid would come and hit the earth, because so how many kids that our ancestors had? My grandfather has, I think, 10 kids. My grandfather's grandfather or father might be having maybe a dozen kids or a half a dozen kids. How many kids any of us are having? Two kids, three kids maximum, not more than that. So it could see that some decline in the number of kids, and ultimately it could reach a stage that people would not have any kids, and then slowly humans will extinct. Just whatever. So I'm talking about the resource scarcity. Resource scarcity will be there. Resources will be at scarce for sure. Okay. I hope you are listening to me. I'm just speaking. Can anyone confirm, please? Can anyone please confirm? Oh, thanks, thanks, thanks. Yeah, thanks. So AI in nursing education and training. I don't need to say talk much about it. Already you are using chat GPTs to prepare your documents and all. This is one step, but the education should be everlasting. As long as you want to be in the field, you should have the continuous learning. That's how I am in the field. It's not like you should not be stagnant. You have to continuously learn, you have to continuously read, you have to continuously learn new things. So for that, you have to utilize most of your time for the things that, you know, uh, not to the laborious jobs or repetitive jobs, not to write documents, but to think about the documents. You put your ideas, you give your ideas to AI assistants, AI tools. Those ideas are as an input for AI, and then it can transform it as a document. Or uh, education, education is a never-ending procedure, a never-ending practice. You have to learn, you have to be educated always. This is not only confined to certain part of technology education, but also nurses. Nursing education is very, very important. You also have to learn. So far, if you are not continuously learning, you need to start learning. Okay. So technology is involved in each and every area. Technology is not only confined to technologists. If you really look at it, you know, how many of you are using, one thing about technology? In 1960s, there was a protest happened by mathematicians to ban calculators. I read somewhere, of course. I don't know about 1960s, but I know the calculator was invented, and then people started using calculators, and then some of the mathematicians protested in, I think, in England, that stop using ban calculators because they were so scared that the calculators they will lose their jobs due to calculators. Uh, that's what actually. The technology is inevitable. You cannot stop. the evolving technology. But you need to evolve along with the technology. You need to embrace the technology. That's how you can grow along with the technology. You cannot say that stop because we are going to lose jobs. Can you please stop all the robots in nursing? Okay, we are losing your jobs. Can you please stop the innovation? It cannot happen. It cannot be happened. It cannot be happened. It is innovation and the technology is inevitable in each and every sector. You are not a IT guy. Still, how many of you are not using Microsoft Excel or Sheets or spreadsheets or PowerPoint presentations? You started using technology. How many of you are not having a computer? How many of you are not using a mobile phone for your learning? So technology, you already gelled with the technological equipment. So you also have to embrace the technology. It should be part of your learning process. It could transform many areas. Also, the education in nursing education. So when you are in nursing, unless until you are already unless until you are given some duty in a hospital, you cannot see the real challenges that nurses faces. Education, whichever is documented, you may read it, you may learn things, but unless you really see the real time things, what things are going to happen, how to deal with the patients, you never know. But what if the AI can give you some insights into what is the realistic uh, environment, uh, risk-free environments for the development? Of course, I'm talking about providing realistic and risk-free environment skill development. What if the AI give you insights into AI is going to give you the insights into what is going to happen? It teaches you that, see, if the patient is like this is how you have to react. It's not like you go and call the other sister who is doing something else, a senior. Of course, you can take always help from the seniors, but what if the education that is required, the AI is going to give you? So many things that unless we unless we really experience, we cannot foresee the things. We cannot really know the things unless we really experience. CPR is the best example. We know that CPR, what the CPR is, all of us, many of us. But really, unless someone does the CPR, he or she doesn't know what the CPR is, how much pressure to have to be applied. I know what the CPR is, but I never did the CPR, so I don't know. But what if the AI teaches me that how exactly, what is the exact part that CPR I have to do, how much pressure I have to apply to do the CPR, what are the outcomes that I may experience after doing the CPR, how can I bring the effectiveness of the CPR as if the CPR has been done by me earlier, what kind of experience I acquire through AI, how good it is, which is called a realistic development. So you know that pilots, most of the pilots they simulate. There are simulations for the pilots. There would be simulations for the nurses as well. There are dummy patients. Okay, you have to react to the patient. Okay, you AI would help you. Maybe robots, maybe a dummy patients. I'm telling with just some visualization. I'm not telling that this is already happening, but I'm just telling you that it may happen. This may happen. The simulators would enable you to do all these tasks as if the real patient is suffering from something. How do you react and how you have to react? This is part of the education. Most of the education is classroom driven education, but not on a real patient, right? But you cannot experiment on the real patient as well. That's there is a negative part of the you cannot go as a student. You cannot be allowed on a real patient and then okay, you just take care of the patient. If your senior does that, then it is not good as well. He has to stand nearby you, stand along with you. He or she should be standing along with you and then teach you how to do, what not to do. So the simulations would come into the picture. The simulators would help you how to respond during emergencies. AI can bias ethical AI and unethical AI because since There is a negative and positive, positive and negative part of each and everything. Okay, one thing is the adoption of the AI grows. The focus should be more on ensuring the ethical use and addressing the biases in AI algorithms. So AI biases are not human biases. AI biases are based on the data. What if the whole data that is given as input to the AI, which is not correct data? So then there is a chance of uh, the malfunction of the AI as well. Okay, it's a malfunction of a document, malfunction of a calculation is different, but malfunction of a patient's health is very severe. It's a highly high it has to be taken with the highest priority. So ethical AI and bias. I'm sorry. There are chances that AI may be biased. I'm sorry. Due to the data that is given, AI is not a human. AI doesn't have emotions. So it is not biased based on the circumstances, it is biased based on the data that is fed to the AI. But definitely you have to sit with the AI at times and then understand whether it is doing its job correctly or not. Recently, I got to know that about radiologists. Radiologists' jobs are at stake because AI is doing a lot of work. But radiology data jobs are not at stake. Radiologist jobs are not at stake because radiologists are still required. But AI would help assist the radiologists to do their job. Their job would be made easy because if you look at MRI, you can do only fewer number of MRIs per day. You cannot do 1,000 MRIs per day because it takes a lot of time. What if AI would assist to do more MRIs so that it brings down the doctor's job easy? Of course, the job of a doctor with respect to MRI is not the writing the report. It is because of most of the thing is put the patient into MRI machine. I think 45 minutes it takes, I guess, to keep the patient in the MRI machine. But to report and all, AI comes and helps the doctors. It would be very easy for the doctors. Right. Again, can they rely on the AI? Can the nurses rely on the AI 100%? It depends on, may or may not. So the ethical practices are very, very important. Okay. This is what. So mental health support, many organizations are already using mental health support. You can call and speak to a psychologist. What if the AI can assist you? It is going to be pretty good. So already mental health related AI assistants are in the place. AI would do a lot of the mental assistant to the patients. If they are psychologically ill, they are feeling low and all, they can contact an AI and then AI can help them. This is already in there. Drug driven, I'm just taking little fast because of time. AI driven drug management, of course, optimize the medicine administration and then management. What kind of reduces the medication errors? Medication errors are pretty common. Maybe sometimes a nurse forgets to write down whether the medicine is given to the patient. The next nurse comes into to the duty and he may again give the same medicine. There are some chances like that. Everything can be, all these errors can be brought down by incorporating AI into all these things. Telehealth has become very, very famous nowadays. Instead of a doctor or a nurse speaks, AI can assist as and where possible, not everywhere. So AI will enhance telehealth platforms, particularly telehealth is becoming a lot of booming sector. AI would help. Workforce optimization, I already told you that uh, nursing shortages by nurses are at scarce. There is a lot of scarcity for the nurses and doctors as well. So how AI can do the workforce optimization is also key point. AI would help in many areas so that the number of hours that are not has to work would be reduced so that these nurses can be used elsewhere. The AI would take most of their jobs and then nurses can really focus on what they are supposed to do. So interoperability is very important. You have to work with the data. Seamless integration with the data is very important. It's not the data that just gets fed into the system, but it is also how whether the data is accurate is or not is also very important. So interoperability with the data integration, because data, unless the data is integrated into the systems, AI cannot work. So how the data is going to be integrated into the system, how legitimate the data is, how important the data is also very important. That can be done by AI. And of course, there are so many challenges and with the AI as well. Data privacy and security. Privacy is one of the most concern. Sensitive data is very, very important. Particularly the European data standards are so strict that the data should not be exposed outside. The data should not be leaked. So definitely with the advent of AI and all, there will be stricter rules with the data privacy and security. Ethical practices and unethical practices are everywhere. AI, it ensures that the decisions are very important with the patients. So AI decisions, you have to ensure that whether the decisions that are taken by AI are ethical or not ethical. These are the challenges. All the AI models should be trained actually. How do you train? By giving the proper data. At the same time, nurses also should be trained to work along with the AI. So these are the considerations. You are leaving a nurse to work along with the AI. A nurse should be trained. They should have to acquire sufficient adequate AI skills using tools or using robots or using IoT devices or whatever. The more technology used, definitely the more cost it would incur. Okay, that's pretty important thing. A robot cost actually 20,000 rupees, whereas the nurse cost only 10,000 rupees. Generally, a patient would always go for a nurse rather than a robot. I'm talking about a common patient. So there are challenges with the cost and the accessibility as well. So that over the period of time, these things would be available with an affordable price. Okay, these are the challenges and the considerations we have to take. So any questions you have, you can, I have my YouTube channel as well. You can type Jitin Palaparthi is my name, but my YouTube channel is more on the technology aspect of it, but I would also add the AI and Gen AI related things going forward. This is what about the session. Thank you very much for your time. I really appreciate you guys for inviting me to give this seminar. The time is limited, even though I requested for more time. Unfortunately, due to your busy schedule and tight timelines, I have got limited time, but I hope I explained the things. So I didn't read the PowerPoint presentations. That is not the way how I do. PowerPoint presentations are again assistance for you. Uh, but I try to speak a lot rather than driving through the PowerPoint presentations. PowerPoint presentations are available to you. You can always go back and read them. But I would like to have the human interaction more than PowerPoint presentation. That's what I did. So any questions you have, please do ask. Thank you very much.